we have secured lives of millions of Kenyans who would otherwise perhaps have passed away because either one, they were not even aware in the first place that they have, for example, HIV and AIDS, or TB or malaria.
It has contributed to a reduced HIV prevalence. Currently, the prevalence in the country stands at about 4.4%.
Those who have TB and diagnosed with HIV have been put on treatment at a rate of 96%.
In the malaria indicator survey that we did in 2020, showed a drop in the malaria prevalence in the country from 8% to 5.6%.
In the approach to the new millennium 2000, Kenya had severe, dreadful HIV epidemic, ravaging malaria disease burden and drug-resistant tuberculosis, sending medical experts into a spin. But in the last 2 decades, the country has experienced a notable decline in HIV, malaria and TB prevalence, attributed to Global Fund and the Kenya government's efforts towards zero new infections and total prevention of the 3 diseases.
Kenya got 415 million USD. And this 415 million USD, Treasury or the state managed to get 293 million USD, while the rest was divided among Kenya or non-state PRs, that is Kenya Red Cross and AMREF.
The funding was as a result of a request from application jointly developed by an all-inclusive KCM membership comprising representatives from national and county governments, civil society organizations, persons living with or affected by HIV, TB and malaria, key populations, adolescents and young people, development and implementing partners, among other stakeholders.
That has helped us to really be able to have very, very successful, very sound decisions being made through that sharing by the different groups that are represented. And as a KCM, we basically just try to ensure that we are well aligned to our national priorities, continuously monitor the various programs by the different recipients, and we also ensure that we keep records of our achievements and ensure that those are communicated to the Global Fund in terms of how have we been able to achieve what was discussed and agreed upon at the grant writing proposal level.
Other than attracting and mobilizing resources from the Global Fund, another key role of the Kenya coordinating mechanism is to ensure effective and efficient use of these resources, to ensure that the community members and beneficiaries are accessing treatment at no cost.
Malaria remains a major cause of sickness and death, with more than 70% of the population at risk of the disease. The malaria grant supported community case management of malaria, including mass distribution of long-lasting insecticide-treated nets, diagnosis using malaria rapid diagnostic test kits (RDTs), and treatment with Artemether lumefantrine, and supporting the community health strategy in fighting malaria in lake endemic and epidemic counties.
We focused on 8 counties around the lake region. We sought to test, treat and track. And so the disbursement or the implementation of projects was really guided by the National Malaria Strategy.
We are targeting to distribute 15.7 million nets by the end of this grant. We engage the community health workers, the village elders, in registering households that are going to receive these nets, in mobilizing the communities and creating awareness about the net distribution, and in the actual distribution exercise itself. And these 15.7 million nets are going to cover 25 million Kenyans and protect them against malaria.
Kuna mtoto alikuwa mgonjwa na sikujua ni nini, lakini kumpeleka hospitali niligundua ilikuwa malaria. Mhudumu wa afya alituelezea umuhimu wa kulala ndani ya neti, na tangu hapo malaria imekuwa chini sana. Kwa nyumba yangu niko na neti 2, sijaishuhudia tena malaria.
For malaria, the grant is 15 million. And you are working with 11 sub-recipients. We build their capacity, they are able to identify presumptive malaria cases, They do a diagnosis using a malaria rapid test.
The lake endemic regions where the prevalence is highest, we saw the prevalence dropping from 27% in 2015 to 19% in 2020. And that is thanks to the various interventions that we've implemented with the support of Global Fund.
Kenya has been a pioneer in numerous global health innovations such as HIV self-test kits and pre-exposure prophylaxis PrEP, to the successful trials on malaria vaccine and adult and child-friendly TB medications. The country has had great success in putting 1.3 million people living with HIV on treatment by March of 2021, up from 98,000 in 2006.
Between 2018 and 2021, we've been able to make progress, not only in the 390s, but even in the prevalence between children and adults. The first 90, we moved from 73% to 81%. The second 90 is still 73% to 81%. And then the third one is 65% in 2018, and right now we are doing 77% as at April 2021. Yet there have been challenges here and there, but we have really achieved a lot, and we are really grateful for the support from Global Fund.
This grant has really been instrumental in terms of trying to bring down the HIV incidence. This cohort in our last data showed that if you look at the young people, and especially if we add the cohort of 15 to 29, they contribute close to 61% of new HIV infections in the country. So as such, this grant has really been instrumental to seeing that we begin to lower those incidence levels.
The Kenya Red Cross Society received $73 million from the Global Fund to implement this grant, whose key intervention areas included increasing access and uptake of HIV prevention services and commodities, and also promoting community-based approaches to HIV service delivery, and also improving initiation of treatment and care.
The funding request underscores the elevated HIV prevalence among Kenya's key populations, estimated to be 29.3% among sex workers, 18.2% among men who have sex with men, MSM, and 18.3% among people who inject drugs, PWID. These levels are 3 to 5 times greater than the national average, 5.6%. To address these issues, Kenya proposes several innovative interventions for key populations. HIV self-testing and pre-exposure prophylaxis PrEP is included.
Before the interventions, we did not have the 11 men who have sex with other men facilities, but after the support of 2018 to 2020, we have those facilities, and we have seen the number increase.
People are able to talk about themselves, about their sexuality, mental health. People are going through a lot of mental health issues because you are discriminated by your parent, you are discriminated by your friend, but you have a space, a safe space where you can come in and be accepted of who you are and get services without stigma.
We have been able to build capacity of the sub-recipients and networks of people living with HIV, networks of key population, networks of adolescents and young people, advocacy, etc.
We had around 10 adolescents and young people led and adolescents and young people based organizations getting a capacity building fund from Kenya Red Cross. They have been implementing behavior change programs and providing psychosocial support. So we hoped to set up wellness centers where young people can walk in and receive any service that they would want to receive, whether it's HIV, SRH integrated services, whether it's counseling services they seek, or just a center where information is being distributed.
While the previous phases have their own targets well achieved, the phase between 2018 and 2021 has been strong in involving the community-based work, including the empowerment of women, coupled with a strong partnership between Kenya and international partners, which has helped boost the response to HIV, tuberculosis, and malaria.
If you look at the number of people who are on the life-saving treatment, out of the 1.5 million estimated people living with HIV, more than 1.2 million are already on treatment. So this is one of the largest antiretroviral treatment in the region. So we need to congratulate, the country, the leadership for this milestone.
Kwa hiyo ukishaamka asubuhi utakuwa unafanya nini? Utakuwa na meza.
Nilikuwa depressed, nilivyojua nimeathirika but hizo mafundisho zenye ili shirika imekuwa ina hold imetusaidia. Mimi imenisaidia mpaka nimelea mtoto wangu saizi ana miaka 2 na mtoto wangu yuko negative.
Na wakuta watu wa pharmacy na wanyenyekevu wananipatia madawa. CD4 account zangu wakati wa kwanza nikipimwa zilikuwa chini sana, lakini baada ya muda wakati wakinipima ninaona zinaweza kuimprove, zinakuwa vizuri. Hata mwenyewe najiona nina afya sasa, nafanya kazi zangu vizuri.
The FBOs have been very key in all the interventions. Our advocacy messaging has been on the healthcare needs of all Kenyans as it's enshrined in the Constitution. The commodities that have come from these programs, the ARVs, malaria medication, the reagents, all those things that make this environment good for Kenyans has been supported in this program.
The evolution of management of health from the national to the local level since 2013 promises to transform the way healthcare is managed and delivered in the country.
We achieved a lot of things in elimination of stigma. We also achieved in linkage to treatment of ARVs. We have also been able to virally suppress all the patients that have been on ARVs to a level whereby most of them cannot transmit. A lot of children have been born of HIV mothers and they have come out negative.
So that is really significant contribution and a big load lifted from the government of Kenya's back, you know. So it is important that we inbuild these systems just to ensure that we have a level of accountability and a level of sustainability should the time come when we are weaned off donor support as a country.
Global Fund was able to employ for us data management assistants in the 47 counties, and as well as laboratory specialists who are even supporting us during this COVID-19. In COVID-19 testing, they are really been able of help, not only in genome sequencing, but as well as being able to deal with the many samples that are coming on board. And as well as the DMAs were able to give technical assistance to the counties to be able to analyze the data, be able to use it to make the decisions as they put in different interventions.
As for TB, the country is listed as one of the 30 high-burden countries that together account for more than 80% of the world's TB cases. Kenya is signed tuberculosis grants amounting to 6.3 billion shillings for January 2018 to June 2021. The funds will be managed by two principal recipients, the National Treasury 3 billion shillings and Amref Health Africa 3.3 billion, supporting procurement of TB medicines, equipment, diagnostic supplies and therapeutic feeds complement government efforts by putting about 338,550 new TB cases on treatment by 2021, provision of medicine to 1,890 drug-resistant tuberculosis cases until June 2021, short-term regimen for treatment of drug-resistant TB cases, which has shortened treatment from 24 months to 9 months, and capacity building for facility and community health workers.
Under tuberculosis, we are working with 38 sub-recipients. We buy the national needs for cartridges, working together, of course, with KCM and the programs, and that goes into supporting the diagnosis of both drug-sensitive tuberculosis and drug-resistant tuberculosis. We actually support, on an average, every month around 500 to 600 patients. We give them a monthly support of 6,000 Kenya shillings.
Sasa nikakuja nikapimwa, ikapatikana ni ile kupwa, ni ile mesiti, ni ile extra resistance. Wakati nilianza ndawa, nilianza kuona improvement kabisa.
We have a machine called the Gene Expert machine, where it's able to diagnose TB, and also apart from that, it's able to tell us about whether there is resistance, and also we do follow-up for TB patients.
Through the partnership with Global Fund, over 226,508 tuberculosis patients have been provided with anti-TB treatment since 2015.
The world has said by 2020, on the journey to the 2035, we should have reduced the incidence by 20%. We are now at 23% reduction in incidence. In terms of mortality, we've managed to reduce by 48%, which is quite significant. Engagement and notification from private sector, we were at 15% reporting by the private sector notification. but now at 25%.
The grant also supported human-rated interventions, for example, human rights, ensuring that the human rights for TB patients are upheld, capacity building for civil society and communities to be able to respond to tuberculosis.
Kenya recently completed a TB prevalence survey to establish the true burden of TB in Kenya and to measure the progress made in TB control. The results of the survey showed that the burden still remains high, with prevalence of 558 per 100,000 and incidence of about 169,000 annually. The burden of TB in men is twice as high as it is in women, 809 per 100,000 compared to 395 per 100,000. And the majority of TB cases, 83%, occur in people who are not living with HIV.
We've realized there's a lot of care out there by private providers, but notification is quite low. So that gap needs to be filled. We need to move away from just curing or treating to prevention as well.
We have been having a challenge for our members of the informal sector to be even tested, even for HIV or TB. If we have been having direct funding from the Global Fund, we could be able to have a team of CHVs in our sector who will be going out to ensure that those people who are infected are able to get tested, because there is already a team within the informal sector who can convince them.
The Global Fund is committed to a rights-based approach to health by scaling up access to prevention, treatment, care and support services for all persons living with and affected by HIV, tuberculosis and malaria.
Different components of the health systems have been also strengthened, including renovation of county pharmacies up to even the county level, strengthening the national warehouse centrally at KEMSA. This has also been done through this support.
The coordination assists in the fact that you're able to avoid parallel procurements and ensure that you don't over-procure or under-procure. And also it ensures that there are no expiries when you coordinate, because everything now is coming through one pipeline, and as well as ensuring that the policies laid down by the Global Fund are followed to the letter to ensure that these products are here in good time.
The Global Fund support in strengthening the system for specimen referral from the lower level facilities to the national reference facility. We are able to identify mutations for both the HIV and the TB patients. This current analysis can also be able to inform us whether the current regimen that we are using, the current diagnostic system that we are using as a country, need to change or we need to streamline it. We've been able to support 60 facilities around the country to be able to access this quality assurance material.
The implementation of this grant have been affected so much by COVID. Because of that, Global Fund has given additional funds so that they can cushion the effect of the implementation of the activities which have already been done.
There was a curfew, there was the lockdown, and in the health facilities, for example, there was disruption, and some of the people who are on ARVs could not afford even a meal. Of course, we intensified sensitization at the community level and amongst all the beneficiaries so that people could learn more about COVID, know how to prevent, and also know how to take care of themselves in the event that they got infected.
COVID came with a lot of stigma. So most patients who had TB or who had symptoms that were likely to be TB kept off from going to seek medical care. And the few facilities that had been set up came to serve COVID patients. And so TB patients were left without facilities to isolate them.
Pregnant women who need to get their 3 doses of anti-malaria to protect their unborn baby, we're seeing a situation where they no longer come to the hospitals. People are afraid of contracting COVID. So this has hit the malaria program.
The current rules and guidelines within countries has also influenced the shipping in of commodities. So we have actually had a delay in the acquisition of commodities within the country. So that in itself has also contributed to a reduction into the indicators that we're actually having.
The Global Fund came in very quickly and was able to fast track the availability of resources, and as a country we got 3.4 billion Kenya shillings, which is $34 million as our first tranche of support from the Global Fund, all going towards very, very strategic interventions that have helped us to minimize the infection of COVID-19 to people who are already living with the 3 diseases.
A mechanism was set for the COVID-19 response mechanism, and we were able to also go back to our members and inform them about this and what they can do, and we work together closely with the government and other organizations, and that is actually commendable to the Global Fund. And up to now that we've seen that COVID is right here to stay, so we are coming up with mechanisms to be able to adapt, to the new normal, and it's upon us to actually give the information to our constituents members.
We were unable to meet physically, and so we had to embrace technology, and we decided to come up with the virtual meetings, which we were able to do the meetings online.
KCM oversees grants, supports PRs, and initiates the replacement of consistently poor-performing principal recipients.
The Oversight Committee actually saw a gap and in terms of implementation, and came up with a tool that would be able to monitor the financial data that would be coming in from the PRs. It would be able to monitor any bottlenecks or challenges experienced within the grant, and would also be able to monitor high priority pending activities within the grant across the different PRs and stakeholders that we have.
We have a new entrant now to also address the issues of health systems. So we have what we are calling the RSSH Technical Working Group, that is Resilient and Sustainable Systems for Health. What we endeavor is to reduce the gaps, and that is evident with each and every new cycle, grant cycle.
We have steadily and continuously increased our allocations as counterpart funding for the Global Fund. Indeed, we have met our obligation of ensuring that we contribute at least 20% of what the Global Fund provides to us. And actually in this financial year, the government has put aside 4.1 billion shillings in its budget for purposes of ensuring that we meet the requirement for us.
Moving into the future, one thing we need to do is to align our implementation arrangements with the new constitutional kind of arrangements.
It's one of the grants we call the catalytic grant. It makes other wheels move.
We need this fund until we make sure that we have reduced these 3 diseases, HIV, malaria, and TB, to levels that our government can actually take care of using our own resources.